The dog wouldn't let anyone near him. Not the orderlies, not the attending physician, not the security guard who'd been called twice in the past hour. The animal, a Belgian Malinois named Kodak, still wearing his service vest, still on duty even here, had placed himself between the man in the bed and every person who walked through that door, and he wasn't moving. Nurse Simone Pratt had heard about the patient before she'd ever set foot in room 14. You always heard about the difficult ones first. It was hospital culture, the way gossip traveled faster than any chart update. By the time she'd clocked in for her night shift at Riverside Behavioral Health, the story had already made 3 full rotations through the break room. Retired Army Ranger, 41 years old, admitted involuntarily after a neighbor called 911 when she heard him screaming through the walls at 2 in the morning, not screaming at anyone, just screaming, the way men sometimes did when sleep dragged them back to places they couldn't escape even awake. His name was Thomas Adler. He'd done 4 deployments. He hadn't spoken a full sentence since they brought him in, and he had a dog that nobody could touch. Simone had read the intake notes 3 times in the elevator. She noticed what wasn't there just as much as what was. No next of kin listed, no emergency contact. Just a name, a rank, a discharge date, and a service animal certification number that the admitting nurse had apparently tried to photograph before Kodak stepped in front of it and refused to move. She stopped outside room 14 and looked through the narrow window in the door. Thomas Adler sat upright in the hospital bed with his back against the headboard and his knees drawn partway up, arms loose at his sides, eyes fixed on the middle distance the way people's eyes went when they were watching something nobody else in the room could see. He was still wearing his own clothes, dark green Henley, cargo pants, because nobody had been able to get close enough to hand him a gown. Kodak lay across the foot of the bed, head up, amber eyes tracking the door. Simone had been a nurse for 9 years. Before that, she'd spent 5 years in the Army as a combat medic, 2 of them forward deployed in places the news didn't cover anymore. She'd sat with men in conditions far worse than this one. She'd learned a long time ago that the worst thing you could do with someone who was wound that tight was walk into a room like you owned it. She knocked once, soft. Then she opened the door slowly and stopped just inside the threshold, close enough to be in the room, far enough that she wasn't crowding anyone. Kodak's ears came forward. He didn't growl. That was something. "Mr. Adler," she said, "I'm Simone. I'm the nurse on tonight." Nothing. His eyes didn't move. She didn't push. She looked at Kodak instead, which was partly strategic and partly genuine. She'd always liked Malinois, their intensity, the way their attention felt like a physical thing pressing against you. This one had the particular stillness of an animal that was working. Not resting. Working. "Good dog," she said, to no one in particular, and she meant it. Thomas Adler's eyes moved, just slightly. Not to her, to the dog. Something in his face shifted in a way that was almost imperceptible unless you were watching for it, and Simone was watching for it because she'd learned to watch for exactly that, the small involuntary softening that happened when someone heard their person praised. She came 3 steps further into the room. Kodak tracked her but didn't move. "I'm not going to ask you to do anything tonight," she said. "I just need to check your vitals. You can tell me to stop at any point and I'll stop." She waited. Thomas Adler looked at her for the first time. His eyes were gray and completely exhausted, and somewhere behind the exhaustion there was something harder, the calcified wariness of a person who had learned not to trust quickly or easily or maybe at all. "How long have you had him?" she asked. A pause. Long enough that she thought he wasn't going to answer. 6 years, he said. His voice was rough with disuse, like something that hadn't been run in a while. "What's his name?" "Kodak. What branch?" The question landed differently than the others. She saw it in the way his posture changed, barely, the slight straightening of the spine that wasn't defensive but something else. Recognition, maybe, or the instinct of it. 75th Ranger Regiment, he said. Simone nodded once. 3rd Battalion? His eyes narrowed. 2nd. I was in the 10th Mountain, she said. Combat medic. Kandahar, 2011-2013. She said it the way you said things in that context, not to impress, not to build rapport through calculation, just to establish what she was, where she'd come from. She watched him process it the way she'd watched soldiers process a lot of things, slowly, thoroughly, cross-referencing it against everything else in the room before deciding whether it changed anything. It changed something. Not much, not immediately. But the set of his jaw was slightly less locked when he finally looked away from her and stared at the window, and he didn't say anything when she moved to the side of the bed and began carefully to check his blood pressure. Kodak watched her the entire time. He didn't growl. She didn't push anything else that night. She took his vitals, she charted them, she left a cup of water on the bedside table without commenting on it, and she told him she'd be back in 2 hours. She was. She came back every 2 hours all night, and by the third visit he was drinking the water, and by the fifth visit he'd said approximately 11 words to her total, but they were 11 real words, not deflections, not hostility, and by the time the sun was coming up and her shift was almost over, she felt the particular cautious optimism that she'd learned not to trust too quickly but couldn't help feeling anyway. Then she went to update his chart and found the notes from the day shift. The attending physician, a doctor, Vance, whose name Simone had seen on charts before and never particularly liked for reasons she hadn't fully articulated, had written a recommendation for Kodak to be removed from the patient's room and transferred to an animal holding facility for the duration of the admission. The clinical justification given was that the dog was creating a barrier to treatment and had displayed threatening behavior toward staff. Simone read it twice. Then she read the incident report that had been filed alongside it. An orderly named Preston had tried to take Kodak's vest off. Kodak had blocked him. Preston had described this in the report as an attack. She sat with that for a moment. Then she pulled up the ADA compliance guidelines for psychiatric facilities, the VA service animal policy, the specific federal protections for psychiatric service animals, and the Riverside Behavioral Health's own internal protocol, which she had read in full during her orientation, and which she now read again, carefully, in its entirety. She printed 3 pages. She went looking for Dr. Vance. She found him in the hallway outside the nursing station, tablet in hand, in conversation with the unit charge nurse, a woman named Sandra who Simone generally respected, but who had the particular habit, when caught between a physician and something uncomfortable, of finding something else very interesting to look at. "Dr. Vance," Simone said, "I need to talk to you about the order on Thomas Adler." He looked up from his tablet with the expression that certain physicians had perfected, the one that communicated being interrupted without technically being rude about it. "The service animal situation. The service animal removal order," she said. "Yes. He's been here 14 hours, and nobody's been able to complete a full intake assessment. The dog makes it impossible for staff to. The dog makes it harder for staff to approach without warning," Simone said. "That's different. And I completed a partial assessment last night. I can have a full one done by this afternoon if you let me continue the approach I started." Dr. Vance looked at her with the expression that followed the first one, the one that acknowledged she had said something technically reasonable while conveying that he intended to proceed anyway. "The recommendation stands," he said. "We have a duty of care. We have a legal obligation," she said, "to accommodate a veteran psychiatric service animal under the ADA, under the Fair Housing Act as it pertains to inpatient psychiatric settings, and under this facility's own policy, which I have here." She held out the printed pages. "Removing Kodak without exhausting documented accommodation alternatives first would expose this facility to a federal complaint. I can also tell you that removing that dog would cause Mr. Adler significant psychological harm, which I've observed directly, and would likely make it impossible to complete any kind of meaningful treatment while he's here." Sandra was looking at the floor. Dr. Vance was looking at Simone with an expression that had moved past physician inconvenienced and into something less comfortable for both of them. "He's been here 14 hours, she said again, quieter now, which was sometimes more effective than louder. "I've spent 6 of those hours in that room. He's talking. He's drinking water. He's starting to come back from wherever he went. That's progress that nobody else has gotten from him, and it happened because we were patient and we let him keep his dog. Please don't undo that." There was a pause that lasted long enough to become its own statement. "Continue your assessment," Dr. Vance said finally. "I'll revisit the recommendation at 48 hours. He walked away. Sandra looked at Simone. "You know he's not going to forget that." "No," Simone agreed. "I know." She went back to room 14. Thomas Adler was in the same position he'd been in 6 hours ago, back against the headboard, eyes toward the window, Kodak at the foot of the bed. But he looked up when she came in, and that was different. Looking up was different. "They're going to take him," he said. It wasn't a question. "Not today," she said. "And I'm going to do everything I can to make sure it's not any day." He looked at her with the flat, evaluative look she was coming to recognize, the look that processed new information without committing to a response before it had been fully vetted. "Why?" he said. "Because it's the right thing to do," she said. "And because Kodak is clearly still working, which means you still need him, which means removing him would be clinically wrong. And because—" She paused. "Because I've seen what happens when someone comes back and nobody makes room for the parts of them that are different now. I've seen it enough times." He was quiet for a moment. "Kandahar," he said. "Not a question either." "Yes," she said. He looked at the window again. Outside, the parking lot was filling up with the first of the day shift's cars, small and ordinary in the morning light. "Second deployment," he said slowly, like he was feeling out the edges of words he hadn't used in a long time. "I had a guy in my unit. After the third IED hit, he'd freeze. Not fear, not exactly. Just the circuits would trip. They sent him to a facility like this. They took everything familiar away from him and put him in a white room and told him to talk about his feelings." A long pause. He didn't make it. Simone sat down in the chair beside the bed. Not because she'd planned to, just because that felt like the right response to what had just been said. "What was his name?" "Pryor," he said. "Evan Pryor. I'm sorry about Evan." He didn't say anything, but he nodded. Once, a small movement that felt like something being allowed rather than performed. "Kodak was his first," he said after a while. "Dog, I mean. Not Kodak wasn't Pryor's dog. But after Pryor, I started looking into the service dog programs. Someone told me about the research. The cortisol stuff, the way they can interrupt a flashback cycle before it completes." He looked at Kodak, who looked back at him with the absolute patience of a working dog who had been in this moment 1,000 times. "First night I had him, I slept 4 hours straight. Hadn't done that in 2 years. She let that sit for a moment. 4 hours, she said. 4 hours, he said, and there was something in his voice that could have been almost wry, almost the ghost of something that had once been humor if you listened for it. She did. That afternoon, she completed the full intake assessment. It took 3 hours, and most of it was conversation rather than formal questions, and she wrote it up carefully, documenting not just what he'd said, but how he'd said it, the engagement, the trust that's forming slowly and with great effort, the specific role Kodak played in keeping him regulated enough to be present. She submitted it before Dr. Vance's 48-hour review. She also sent a copy quietly to the hospital's patient advocate. What she didn't anticipate was Preston. He'd filed a supplemental report while she was with Thomas. In the supplemental report, he'd noted that the primary overnight nurse, not named, but the implication was clear, had allowed the service dog to occupy the patient's bed in violation of infection control policy, had permitted the patient to remain in civilian clothing against standard intake procedure, and had, in his estimation, exceeded the nursing scope of practice by engaging in what he described as unauthorized psychological intervention. The supplemental report landed on the unit director's desk at 3 in the afternoon. The unit director, a man named Holloway, whom Simone had always found difficult to read, called her into his office at 4. She brought her own documentation. She had the intake assessment. She had the printed policies. She had a time-stamped log of every visit she'd made to room 14 and every clinical observation she'd made in the course of those visits. She had, because she had started keeping it the moment she read Preston's original incident report, a written record of every relevant conversation she'd had with Dr. Vance and Sandra, including the time, the location, and what had been said. Holloway read everything she gave him without speaking. "Preston's report characterizes what you did as outside nursing scope," he said finally. "What I did," she said, "was perform a nursing assessment using therapeutic communication techniques, which is explicitly within nursing scope of practice under this state's Nurse Practice Act, which I can provide if needed. I also advocated for a patient's federally protected rights, which is also within scope. What I didn't do was perform psychotherapy, make a diagnosis, or issue any orders. If there's a specific action you'd like to identify as outside scope, I'd like to hear it." Another silence. "The dog," he said. permitted under ADA accommodation requirements and this facility's own written policy, both of which I documented before making any decision about Mr. Adler's care. I can walk you through the specific provisions. Holloway set down the papers. He looked at her with an expression she couldn't fully read. "Why didn't you loop in Dr. Vance earlier?" he said. "I informed Dr. Vance of the relevant policies at the first available opportunity after I identified the conflict," she said. "That conversation happened at approximately 7:15 this morning. It's documented. He says you were confrontational." "I was direct," she said. "I didn't raise my voice. I presented documentation. If that's confrontational, then I'm not sure what the alternative would have been." Holloway was quiet for a long moment. "Preston's been here 11 years, he said. She understood what that meant. She understood it completely. She also knew that understanding it and accepting its implications were two different things. "I know," she said, "and I've been here 2 years, and I know what that comparison is supposed to communicate, but Mr. Adler has a legal right to his service animal, and he's a veteran with a documented psychiatric condition who came into this facility in crisis, and the first thing that happened to him here was that someone tried to take his dog's vest off and then wrote it up as an attack." She paused. "I'm not comfortable with that. I don't think the facility should be comfortable with that either." Holloway picked up the papers again. He read for another few minutes, and Simone waited the way she'd learned to wait, still, quiet, present, not filling silence with words just to fill it. "I'll review the incident reports," he said. "Both of them. I'm not in a position to make any determinations tonight. I understand," she said. "I appreciate that you'll look at them." She went back to room 14. Thomas was asleep. This was the first time she'd seen him asleep since his admission, actually asleep, on his side, head on the pillow rather than propped against the headboard. Kodak was at the foot of the bed, awake, watching the door, exactly where he was supposed to be. She charted her observations and left them alone. The next 3 days were not easy. Dr. Vance's 48-hour review came and went without a direct confrontation, which Simone knew was not the same as resolution. The service animal order was technically still active, just paused, pending review. Everything was pending review. She came in for every shift and checked the chart before she did anything else, the way you check the ground before you put your weight on it. Preston didn't speak to her directly, but she could feel the shape of his presence on the unit as something that had changed, hardened, taken a form it hadn't had before. Sandra was professionally pleasant in the way that meant she was carefully not taking sides. Thomas Adler, meanwhile, was getting better. Not dramatically, not in the way that made good television, but in the way that actually counted, the slow accumulation of small things, sleeping more consistently, eating more of the food they brought him, talking more readily and more fully during her visits. He'd told her about his parents, his father a machinist, his mother a school librarian, both of them gone now, and about a sister in Portland who he hadn't spoken to in 2 years and who he thought about more than he let himself acknowledge. He'd told her about the second deployment and the third and the fourth, not the whole of them, not the worst of them, but the edges of them, the parts he could put into words. And he'd told her about the night the neighbor had called 911. He'd been asleep, and then he'd been in Fallujah, and then he'd been back in his apartment, except the apartment was still Fallujah, and it had taken him a long time to get back. And in the meantime, he'd done enough to make the neighbor call, and he didn't remember any of it, and that was the part that scared him most. Not what he'd done, but the fact that he didn't know what he'd done, the gap in continuity, the evidence that some part of him could take over and operate without him. "Kodak pulled me out," he said. "He always does. He knows before I do. But that night I was too far under, and it took him longer, and I guess by the time I came back it was already." He stopped. Loud. Simone nodded. She didn't offer false comfort. She didn't tell him it would be okay. She said, "That sounds terrifying. The gap. Not knowing." "Yeah," he said. "It is." She'd learned a long time ago that the most useful thing you could sometimes do was simply confirm that a thing was as hard as it was, not fix it, not reframe it, just witness it. Agree that yes, this is what it is, and you're not wrong to find it terrible. On the 4th day, the patient advocate called her. Her name was Beverly Oakes, and she had the particular manner of someone who had been doing her job long enough to have seen everything twice and had developed a very precise professional calm as a result. I received your documentation, Beverly said. I've been reviewing the ADA compliance issues and I've spoken with the facility's legal counsel. There are some significant concerns about the way Mr. Adler's admission was handled. The initial incident report, Simone said, among other things. The order for service animal removal is going to be formally rescinded. There'll be a review of the unit's service animal accommodation protocols. A pause. I also want you to know that I've flagged the supplemental report filed against you. Some of the characterizations in it are problematic. I'm going to recommend that it be reviewed in the context of the overall situation. Simone was quiet for a moment. Thank you, she said. I want to be honest with you, Beverly said. This kind of thing doesn't always go well for the nurse involved. You did the right thing, and that's not always the same as the easy thing or the safe thing. I know, Simone said. I wanted to say it explicitly anyway. What you did for that patient, the documentation, the advocacy, going back in that room every 2 hours, that's not nothing. Simone thanked her again and hung up and sat in the break room for a few minutes by herself, not doing anything in particular. Just sitting with the particular exhaustion that settled in after a sustained effort had finally, provisionally, resulted in something. She'd been in the army. She knew what sustained effort looked like and felt like and cost. She knew that winning something didn't mean it was over, but she also knew that some things were worth the cost, and she'd made her calculation on the night she'd read that incident report and chosen to print 3 pages instead of looking away. On the 5th day, she went to tell Thomas. He was sitting up in the bed, not against the headboard anymore, just sitting up, Kodak beside him, both of them oriented toward the door in a way that was less defensive and more simply present. Here, in the room. She told him that the order had been rescinded, that Kodak wasn't going anywhere. He listened. When she finished, he didn't say anything for a long moment. Then he said, "Why did you fight for him?" She recognized it as the same question he'd asked early on, but it was different now, less suspicious, more genuinely wanting to understand. Because you needed him, she said, and because nobody in this building should be able to decide that the thing that keeps you functional isn't worth the inconvenience of accommodating it. That's not care. That's just management. He was quiet. Pryor never had anybody do that, he said finally. Fight for what he needed. I know, she said. I'm sorry. Outside the window, the afternoon light had gone gold and long. Kodak shifted, resettled, put his head on Thomas's knee. Thomas's hand moved to the dog's ears without him seeming to think about it, the gesture of 10,000 repeated moments, automatic and true. My sister, he said. In Portland. Yeah, she said. I've been thinking about calling her. Simone nodded. She didn't say anything. Some moments you didn't speak into. I don't know what I'd say, he added. You don't have to know before you call, she said. That's what the call is for. He looked at her. For a second, something moved across his face that was real and present and not the exhausted distance she'd seen there on the first night. Something that might have been, in someone less weathered, something close to a smile. She left him with a phone and Kodak and the long late afternoon, and she went back to her work. 2 weeks later, she heard from Beverly that the facility review had resulted in mandatory trauma-informed care training for all behavioral health unit staff, revised service animal accommodation protocols, and a formal investigation into the pattern of incident reports filed by certain staff members over the preceding 18 months. The review, Beverly said, had turned up documentation of a pattern that nobody had been paying sufficient attention to. The word Beverly used was systematic. Simone thought about Thomas Adler in a white room without Kodak and didn't say anything. She thought about Evan Pryor. She thought about all the ways that people came back from places that changed them and then were asked by the systems supposed to help them to change back into something they no longer were, to leave the parts of themselves that had adapted and survived somewhere outside the door. She'd been a medic in Kandahar. She'd kept people alive in the field who had no reason, by any reasonable calculation, to still be alive. She'd made decisions under conditions where there was no good option, only the less terrible one, and she'd made them and lived with them, and come home and become a nurse, because the work, it turned out, was the same work. Keep the person in front of you alive, not just the body, all of it. Thomas Adler called his sister. She found out not from him directly, but from the note in his chart. Patient made personal phone contact with family member at patient's own initiative, Conversation lasted 47 minutes. She read it in the break room on a Tuesday evening and felt the particular quiet satisfaction of something that had been moving in the right direction finally arriving somewhere real. She thought about calling it a win and then decided the word was wrong, too sharp-edged for what it actually was, which was closer to. A door opened. A room with a little more light. Kodak had known that first night in room 14. He'd tracked her with those amber eyes and not growled, which was, she now understood, not indifference but assessment. He'd looked at her and made a determination and allowed it to stand, and then he'd sat there, patient and working, between the man in the bed and everything that wanted to get in, until the right person came along who understood what he was doing and decided to help. She thought that was the whole job, really. All of it. You stood in the right place. You didn't leave. And when the system moved against the person in the bed, you printed 3 pages and made sure someone with authority read them. That was what she'd done. That was all she'd done. She went back to work.